In this tutorial, we're looking at the bird dog versus the back extension. I'm going to be looking at which is the more effective exercise for lower back pain. And we're going to look at three parts. We're going to look at compression of the spine, we're going to look at extension of the spine, and we're going to look at the muscles working. So we're going to try and build that complete picture, and then at the end, hopefully you'll be able to decide which is the better exercise, the bird dog or the back extension. Firstly, we're talking about compression around the spine. And when we talk about compression, we're talking about the spinal erectors. And as you can see on the screen here, we've got longissimus and iliocostalis. Now, they are just some of the lumbar erectors, but we just, as an example, we're just going to focus on these two. So when we do back extension, what happens is these spinal erectors, so on the right hand side, as you can see here, we've got longissimus and iliocostalis, and then we've got obviously longissimus on the other side and also iliocostalis on the other side. Obviously these diagrams here are showing a variety of muscles, so I'm just adding them in as I go. Now when we go into a back extension, which is either on a machine or on the floor, we create 4,000 newtons or 6,000 newtons of compression on the spine. And what that means is, imagine the spine being on the inside of this fist, or the spine is the sponge, and we are squeezing the sponge. Compression is the muscles contracting and squeezing, or essentially putting pressure on this sponge. And it's creating, as I mentioned, 4,000 to 6,000 newtons of compression. Now, with regards to the unit, it's not necessarily that important. Even the numbers aren't that important because we need to be able to compare it to something. So for right now, all we need to understand with regards to compression and the back extension is it's creating 4,000 to 6,000 newtons of compression around the spine. What we're now going to do is look at what happens when we do the bird dog. And that is that it creates 3,000 newtons of compression, or if we use the units that we had last time, it would be 2 to 3,000, because obviously that's half of 4,000 and 3,000 is half of 6,000. So it's 2 to 3,000 newtons of compression. Now again, the unit isn't necessarily that important, but why does the bird dog create less compression around the spine? Well, very simply, is it's only activating one side. So when I lift my leg up, as you can see in this diagram here, it's activating those erector spini muscles on the left hand side, because that's the leg that's up. So it's activating the left hand side muscles. When I bring this leg back down into this position and then lift my right leg, it's then creating 2 to 3,000 on the other side. Obviously when we do the back extension, it's using both sides, and that's how it creates 4,000 to 6,000. So what this means in the grand scheme of things, and why the bird dog is a much more effective exercise when it comes to compression around the spine, is if I was to take someone through my consultation and assessment, and I would find that their spine couldn't tolerate great load or great compression, then the bird dog is going to be a much more effective exercise when it comes to rehabilitating the back pain and rehabilitating the spine, whilst also minimizing the amount of compression on the spine. Because what the bird dog is doing is it's activating the muscles in a way that it doesn't aggravate the spine, because it's reducing the compression. So if someone has a compression intolerant spine, it can't take high loads, i.e. 4,000 to 6,000 is going to be worse than 2,000 to 3,000. So from a compression perspective, the bird dog is a much more effective exercise. Next, we're talking about extension of the spine. So obviously when we're doing the back extension, and if we use the diagram that was on before, we've got the sort of the machine or the rack in that position, and then we've got the person with the hips here, and then they sort of fold forward and the head is there, and then what they do is they extend up. If they're led on the floor, obviously they'll be in the neutral position, they'll lift the chest up off the floor and their spine will go into extension. The same will happen here, they will go up to the top into that extension. So this is now the movement that we're talking about, this spinal extension. Now, when the spine is forced backwards into an exaggerated arch, this forces the facet joints. So the facet joints, as you can see in here, is this area here. This area here. So this is where we're in slight flexion, because this space here is wider than this space. And then what we're doing here is we're going into extension because the back is less than the front, which is wider. So all that's happening is this facet joint, so you've got this sort of protrusion here of the vertebra. These are little joints known as facet joints. And all that's happening is these joints are getting compressed together, and then when we go into flexion, they're getting pulled apart. So what's happening is this forces the facet joints to override with bruising of the nerve, stretching and laxity of the joints, and may result in subsequent abnormal micro movements at this segment level or a disc rupture. So segment level basically means this is a segment. Vertebra, disc, vertebra. That's a segment. So abnormal micro movements at this segmental level or a disc rupture. So when we go into this extension movement, it's putting pressure on the facet joints, it's potentially creating abnormal micro movements and potentially assist, well, more so the flexion, but in moving towards a disc rupture. If the person has a disc rupture already, if the material is coming out of here and then we pinch down on it, the material is still out, but we're pinching down on it, stopping it from going back in. So again, it can cause a problem from the level of the disc, and it can also cause a problem from the level of the facet joints with micro movements and potential laxity and inflammation of the facet joint. To add to this extension and the discs and the facet joints that we've talked about so far, we've also got spondylolysis and pars defect. And a pars defect or spondylolysis is a stress fracture of the bones of the lower spine. These fractures typically occur due to overuse. So first of all, we just have to understand overuse, because as we come down here, pars defect are caused by overuse in the lower back, mainly from sports that involve repetitive back bend like motions, examples gymnastics. Now not everyone is a gymnast, so it's not likely going to happen to everyone, but there will be specific cases of people who aren't gymnasts that are going to experience these problems. So what we're starting to find is that these movements into extension are having problems with the nerves, having problems with the discs, having problems with the joints of the spine, and now we're starting to see that they have problems with the bones and the vertebra, because this is where the pars defect happens and the vertebra can move, because it's not fully connected all the way through the spine. So we have to understand this. Now again, these are potentially extreme examples, and there will be problems that people get before these things happen potentially. But all we have to understand is that the extension mechanism is moving people towards this, and people may be more predisposed to it happening to the nerve, to the disc, to the joint, or to the bone. So it doesn't mean that everyone that does this is going to get all of these problems, but there will be specific people that will have specific predispositions to certain ones. But the mechanism is extension of the spine. So again, looking at back extensions, it's becoming a less effective exercise to manage lower back pain. Finally, we're going to be talking about how the muscles work within these two exercises, and again we'll start to find out again listening to our anatomy, understanding our anatomy to point us in the direction of the most effective exercise. So research shows that the aforementioned muscles, which is in fact ones we've talked about already, longissimus, iliocostalis, that attach to the thoracic region are actually the most efficient lumbar extensors because they have the longest moment arm. So when we're doing back extensions, what we're trying to do is focus on moving these muscles into extension for contraction, and then trying to get, in some respects, we're using the bodybuilding principles and using that as a metaphor of strengthening the area to get rehabilitation, essentially. But what we're finding is that as we move up into the thoracic spine, into this area, they are the most efficient lumbar extensors because they have the longest moment arm. And what that basically means is we've got, let's just say, the lower back here. We've got the muscles of the lower back, and then we've got the muscles of the thoracic spine. Now, we need huge amount of strength here to tighten the nut or to strengthen the lower back that's here. But if we can activate the lumbar extensors, then it's much more efficient. We don't need as much strength, but we do need good activation to get the same amount of strength or the same amount of stability through the lower back here because of what is known as the moment arm. So if we can go into postures and positions, so again, if we extend our leg out the back, these muscles here have to hold the torso up. So these muscles aren't efficient at holding the torso in position or the spine in position. It's going to be these muscles because of this long moment arm that goes all the way up to the thoracic part of the spine in iliocostalis here and longissimus here. If we are trying to raise the upper back, we aren't using these moment arms as effectively because we are raising the body from the wrong end, if that makes sense. So we have to understand it from this perspective. That helps us, in some respects, points us towards the right exercise that we want to be doing, which, as I'm sure you're aware, is the bird dog over the back extension. And it goes on to say, thus, exercises to isolate lumbar muscles, which is the back extension on a machine, on the floor, or even on these supposed scientifically proven elaborate back strengthening machines, cannot be justified. Cannot be justified anatomically or from a motor control perspective, because all of the players in the orchestra must be challenged. So again, when we do the bird dog, look at what we can create. We've got glute activation. We've got the erector spinae thoracic muscles creating stability through the lumbar spine. We've got the neutral posture, so the facet joints, the discs, and the vertebrae aren't becoming irritated, and also the nerves that come along with that. And then by lifting the arm and then screwing the shoulder down into the rib cage, we activate muscles like latissimus dorsi. We can also get obliques activated, rectus abdominis activated by bracing the abdominal wall. We will get aspects of posterior deltoid. We will get aspects of rhomboid and trapezius. So we've got multiple players, as is mentioned here, or multiple players in the orchestra being challenged. So all of these muscles are creating this moment arm to hold and stabilize the spine. And we're doing it in a way that reduces the compression to the spine because we're doing it on one side at a time. So we aren't over compressing around the spine. So this is why the bird dog is a much more effective exercise. And I know a lot of people promote these types of machines and these types of exercises where we're isolating off the lumbar spine muscles. But hopefully, as you've discovered in this short tutorial, that it's not as effective to do that as it is using an exercise like the bird dog, because as I've mentioned, it's in a sense reducing the risk of any further injury whilst maximising the muscular activity and getting the muscles to work together so they are able to rehabilitate the spine in a much more effective way. Many thanks for watching. Hopefully it's been helpful. Hopefully now you're able to make a better and more informed decision about the exercises that you choose for lower back pain that will be a little bit more effective for you. If you do want help with your lower back pain, then please do just go down to the links in the description. You've got a choice or a couple of options. You can either do the online course, which is all fully online, workshops, tutorials of me coaching you on each step of the way, or you can do the online course but also with coaching sessions with that, so I can work with you one-to-one and guide you through the online course as necessary, plus with any extras that you need. So many thanks for watching. My name is Chris from Christopher Hall Training. I'll speak to you in the next tutorial.